Thank you, Chairwoman Eshu. We've been battling COVID-19 for more than a year now, and while much has changed in terms of our knowledge and ability to combat this disease, it continues to present these new health challenges. And over 30 million Americans have tested positive for COVID-19 over the last year. Nearly 600,000 have died, and the loss has been devastating. And we're always mindful of the toll this pandemic takes on our families and friends and communities. But over the last year, the subcommittee has played a key role in responding to the ongoing public health crisis. Today, we continue that crucial work as we discuss a consequence of COVID-19 that is perplexing the scientific community. A growing number of individuals are experiencing the lingering effects of COVID-19 weeks and months after their initial infection. These lingering symptoms are being described as long COVID, and it seems to be impacting a lot of people who are otherwise healthy. A full picture of long COVID is still being drawn. Generally, someone is considered to have long COVID if they experience symptoms lasting longer than 4 weeks after their initial infection. Symptoms can include persistent fatigue, brain fog, headache, loss of smell and taste, dizziness, shortness of breath, fever, depression, and anxiety. And in more severe cases, the function of critical organs like the heart and lungs can be affected. We've heard directly from long haulers that the continuation of their symptoms, as well as management of their care, can be more of a battle than the initial onset of the virus, both physically and mentally. And early studies of long COVID are small in scale, but raise alarming trends. One study of about 4,000 found that nearly 15% of the patients developed long COVID. The study also suggested that people with multiple symptoms during their initial infection, women and older individuals, are more susceptible to long COVID. And another recent study in Sweden found that long COVID is prevalent among healthcare workers. It found that 1 in 10 young healthy adults who initially had mild COVID symptoms continue to struggle with moderate to severe symptoms months later. So our goal at this hearing is to learn more about long COVID and what is being done to address it. On our first panel, we'll hear from leaders of 2 of the world's leading public health agencies, the National Institutes of Health and the Center for Disease Control and Prevention. Both agencies are actively monitoring long COVID and are in the process of expanding their research. And I look forward to hearing from our public health experts on that panel. Our second panel will include professionals on the ground who are treating and researching long COVID. And these doctors are actively working to seek out answers to many of our questions. And we'll be joined by patients also on the second panel who will share their own stories about the impacts that long COVID have on their lives. It's important that we hear directly from patients as we take a close look at what's needed to make certain that they and other Americans with long COVID reach a full recovery. So even if a small fraction of COVID-19 patients develop long COVID, hundreds of thousands, if not millions of people will require ongoing interdisciplinary care and may not be able to maintain their quality of life or their gainful employment. So we think it's our responsibility to ensure that we learn more about this, to prevent it when possible, and to help patients afflicted receive the proper treatment. I hope this hearing will help us better understand how we can support further research as well, but also how to prevent and treat those who suffer from long COVID. It's a very important hearing. Thank you, Madam Chairwoman, for doing this. I yield back.